Good morning, everyone, and welcome to the podcast. You'll know me. I'm Andy, the clinical lead at Redicare, and I want to introduce you to our special guest this morning, who is Dr. Donal Collins. And we're going to talk about all things heart disease, cholesterol, saturated fat, all the ins and outs, and the kind of couple of little myths, dispel a couple of little myths as well. Donal, I might let you introduce yourself and just give a little bit about your backstory as well, if you don't mind.
Yeah, hello everyone. Nice to meet you all virtually. I'm Donal Collins. I was a GP in the UK for 27 years. Originally graduated in Cork, worked in Limerick for 5 years, and then moved to the south of England and stayed there for the bulk of my career. And during that time, I witnessed the growth of the diabetes epidemic that's happening all around us. So in my practice, our rates of type 2 diabetes grew by about tenfold compared to when I began. And I suppose reflecting back on my career, despite picking these people up early, putting them on loads of medications, we didn't seem to control them that well. The numbers kept on growing year on year. And with hindsight, we probably were tackling it with the wrong solution. So rather than using a medical model, we needed to be using a different model. And that's what I've spent the last few years of my career trying to do. So using a concept called population health management. So taking big numbers of people, intervening with them in a different way than take more pills, and seeing the outcomes. And it's been great fun, and the outcomes have been fantastic. Personally, I myself developed type 2 diabetes and put myself at significant risk of cardiovascular disease about 7-8 years ago during my career, because I was working long hours, eating really poorly, and having little activity. And actually, it was some patients of mine at the end of my career taught me how to fix it, because I went down the medical model. I took some medications. I went to a big national brand that helped people lose weight, and it had no effect on my metabolic markers. So when I lost some weight with them, my cardiovascular risk did not decrease and may in fact have increased. And then 2 patients demonstrated to me what could be done by turning the guidelines on its head and doing the opposite to what we were saying for the last 30, 40 years. I did that to myself. I lost 20 kilograms in weight rapidly without any effort, reversed my type 2 diabetes, put myself into a better state of health, felt great for it, and then started doing it with patients, and now want to do it at scale online with the guys from Redicare.
Excellent. And Donal, so you alluded to potentially even increasing your risk factors for cardiovascular disease. So I suppose kind of historically, we would look at the old school lens would be get your total cholesterol down, obviously reduce your blood pressure, just lose weight. But weight loss itself is not necessarily correlated with a risk of cardiovascular disease. How have your views changed in terms of what numbers you're looking at now compared to how they did when you were in practice medicating?
So I think the big one for me, while it is good to lose weight if you're significantly overweight, weight is the wrong number to be watching. So that particular national big brand that helps you lose weight, what they do is they give you a reduction in calories. So you have a deficit in calories, so you will lose weight, but it's really high processed and high carbohydrate loads. So in fact, my triglycerides went up during this time, and we can talk about how that's a risk for cardiovascular disease. My HDL went down, and over this time, my blood sugar markers stayed exactly the same, did not decrease. My blood pressure was never significantly raised, but it did not come down during this time.
Did you lose weight during that time, Donal, just as a matter of interest?
I lost about 5 kilograms. 5 kilograms.
That's interesting.
And it was really hard work. I was really hungry all the time, and I was obsessing about food. But what was interesting was because when I did it, I brought this organization into my surgery. So I queued up with my patients. So I was watching what was happening, not just to me, but to the patients I was bringing along to the program. And yes, they were losing weight, but their metabolic markers weren't. So their blood sugars, the HbA1c, which is an average blood sugar, their triglycerides, the HDL, the blood pressures, they were not shifting, which was staggering to me, because you just, everyone was saying, lose the weight, everything's going to be magic. And it wasn't. And
Yeah.
suddenly, and then when I took my patient's advice, I magically lost the weight without even thinking about it. And suddenly I was liberated from the hunger. Triglycerides plummeted, HDL increased, HbA1c came down into the normal range, blood pressure dropped a little bit. And I was feeling great. I was sleeping well, energy levels were good, and my memory, recall, cognition improved, mood improved. And of course, as I was losing the weight, the people around me were saying, what's wrong? Whereas nobody was saying what was wrong as I was piling up the weight for the previous 10 to 15 years.
Yeah, that's a real, I always refer to it as a real Irish thing. Nobody's too concerned when you're 19 and a half stone and everyone thinks you're dying. Then when you get to 12 and a half, it's just I think it's a perception thing more than anything else, because we're so used to seeing weight on people over the last 10 or 20 years in particular. So you alluded to following the advice that your patients had done, Donal, and I suppose to some people listening, their advice may have been counterintuitive. Do you mind talking about what so you said your HDL went up, which is your good cholesterol, broadly speaking. Your triglycerides went down, which is really strongly correlated with risk of heart disease. Everything went in the right direction, but the diet may seem counterintuitive to some people. You might speak to that for a second, please.
So what was interesting with these two guys was they were from Southeast Asia. They were not overweight. They were thin. They had a BMI of about 22, 23. So they would have been in the normal weight category. And if they stood sideways, you wouldn't see the belly sticking out, which I think is the best measure. And essentially what they did was they stopped their chapatis. They stopped rice, and then they ate a lot more fat. So they added more ghee, high-fat yogurt, added cream to stuff, ate more cheese, which, of course, is the exact opposite to what I was shouting at the patients for the previous 20 years. But they moved their HbA1c really dramatically from around 100 down to under 40 in 5-6 months.
Wow.
It was quite extraordinary, and yet doing the opposite to what we were advising. And of course, you would hope that would make people curious. And it's just the system. When I talk about system, I talk about big systems, people who are creating the guidelines, guidance. It's very difficult when you've done that and you've said, we know best, you do what we tell you. And then somebody's saying, well, that's curious because it's not working for me and I'm doing something very different and it seems to have positive effects. So the system does battle against it, but gradually you can see the Titanic is moving and it is being accepted, even begrudgingly, by well-known organizations, both in Ireland and the UK and in the States.
Yeah, absolutely. Loads of the guidelines changing as well. Notably, the Journal of the American College of Cardiology, who published a consensus statement to the tune of saturated fat is not a nutrient of concern when it comes to cardiovascular disease. And I wanted to go on to that next, actually, Donal, because let's talk about cholesterol. I suppose the previously held belief around cholesterol was that it was just, automatically bad or inherently bad, particularly LDL cholesterol, which was referred to as bad cholesterol. And we know that's certainly not accurate. So recent studies have shown that there may be more important parts of your cholesterol to focus on. You alluded to HDL and triglycerides. You might just kind of speak to what your opinion is now after all the research you've done in your own personal experience and clinical experience in terms of which parts of your cholesterol are more predictive and more important to focus on.
So one of the things that you talked about was accurate measurements. And if LDL is a bad thing, what staggers me is we still don't actually measure it. So we measure total cholesterol, HDL, triglycerides, And then we do a mathematical sum, which gives us a guesstimate of what your LDL is. So when you look at your blood results, you're going to see LDL in brackets, estimated, close brackets, because we're not directly measuring it. And based on that substance that we're not directly measuring, that's what people will then drive the statin prescribing. But it was, there's a number of studies out there. One was Framingham study which had a 30-year review recently. And in it, they found that people who had high levels of cholesterol had a reduced all-cause mortality. All right, so the language there is important. So all the research that we'll have heard about before will have just purely been focused on cardiovascular disease. And with hindsight, was probably an association, an element of causation, but more association. But what they found with this was, mortality from all causes, so from Alzheimer's, cancers, and cardiovascular. If you lump them all together, people died less if their cholesterol was high, which again is staggering. And they found the same then in the WHI Women's Health Initiative, 46,000 women. Again, an important study because most other studies were done on men. And again, what's interesting with that is what they found the biggest risk factors for cardiovascular disease was type 2 diabetes, high blood pressure, but high triglycerides, and in the measuring things that you could do, high insulin levels. So triglycerides more than doubled your risk, high insulin level multiplied it by about 6. And if your LDL was high, it raised it by 1.3. So a 30% increase, which is significant. But if you're going to say, give me bang for my buck, let's reduce the big numbers first. But of course, there isn't a drug for high insulin levels. There isn't a drug that will work effectively for high triglyceride levels. And as our friend, we call him Robert Lustig, wrote an amazing book called Metabolical. He would say, these hormones are not druggable, but they are foodable. All right. So if you eat whole healthy foods, your triglycerides are going to come down, your insulin levels are going to come down, and you will overwhelmingly reduce your cardiovascular risk, even if you leave your LDL alone or even let it go a little bit higher.
And I like that you use the word whole, and by whole we're not referring to low fat, low calorie, fat-free yogurts, that sort of stuff. We're including whole sources of fats, including saturated fats, which many people will know as animal-based fats. And just for context there, Donal, for anyone who's not initiated with all our talk around triglycerides and HDL, I suppose, and correct me if I'm wrong here, but you have your total cholesterol number, which is made up of HDL, commonly referred to as good cholesterol. It's actually a cholesterol carrier. There's only one type of cholesterol. LDL, which again is calculated but was referred to as your bad cholesterol, and about a fifth of your triglycerides, as well as a few other floating components as well that kind of factor into it. So the key numbers you're saying there in terms of reducing your cardiovascular risk, when we look at the literature, especially of the last 10 or 12 years, is your HDL cholesterol should be going up, your triglycerides should be going down, and that kind of seesaw effect is driven mostly by insulin levels. So kind of sugar and processed carbohydrate, really.
Yeah. And this was basic biochemistry that was taught to us very early in medical school that we've forgotten over the years. And it was if you eat sugar or ultra processed foods that then get rapidly broken down to glucose, in the front one third of your gut, they're going to fly into your liver. Now, if your storage room in your liver is empty, it'll get converted into glycogen, so a storage form of sugar that then can be reused at times when you're not eating. But if your storage is full, which can happen quite quickly, then the glucose gets converted into fats, which are called triglycerides. And then they'll get stored in the liver, but when the storage gets near full there as well, they spill out into the bloodstream. So your triglycerides start rising in the bloodstream. And similarly at the fat level, so as your belly gets bigger and the fat under your skin gets bigger, insulin holds the fat in those fat cells. So if you become insulin resistant, i.e., the body stops listening to the amount of insulin that's around, that fat starts leaking back out. So you've got one bit being pushed in and another bit pushing out. So it's like, overfilling your cup. I'm pouring some water into my cup, but it's full, so it's going to spill out over. So that spills back into your bloodstream again as triglycerides. So it's really a sign that your body is struggling with the overload from the sugar.
And you made a really important point there, Donal, and that is that, and to kind of break down the technical aspects into more kind of practical takeaways. If your insulin levels are high, and again, your pancreas secretes insulin much more so if you're eating processed carbohydrate and sugar. So, and that includes breads, rice cereals, all the granola bars, frozen pizzas, all that sort of stuff. If your insulin levels are high, you gain weight, but also if your insulin levels are consistently high, it blocks your ability to actually break down fats, to burn fat. So that's relevant from a heart health point of view and also from a weight loss point of view.
Absolutely. If your insulin levels are high, you're in permanent fat storage mode. Really hard to lose weight.
Yeah, absolutely. I wanted to jump onto the kind of saturated fat and cholesterol, because this is one of the more pervasive, you could almost call it myths out there now. In fact, you could. The literature backs it up quite clearly. Can we chat about how the guidelines around saturated fat and cholesterol have changed? Because often this is news to people who are listening to this sort of stuff for the first while. But the guidance around saturated fat, so that includes whole fat sources of dairy, which is explicitly named actually in the guidelines. So cream, butter, cheese, full fat yogurts, and dietary cholesterol itself in the USDA guidelines, the most recent edition, have both changed.
Yeah, and so where we went wrong was back in the 50s and 60s when research was done by a guy called Ansel Keys, who did his famous 7-country study, and there was a straight line link between cardiovascular disease and fat intake in foods. When he died in the 90s, his son released all his academic research to university, and it became clear that the 7-country study, in fact, was a 32-country study. And he just removed all the bits that didn't fulfill his hypothesis. So it was, worldwide dietary guidelines were focused on research that was just wrong. And this is always a challenge with science and research. I'll come up with a hypothesis, so I like things that will tell me I'm right, and I won't like things that will tell me I'm wrong. So I'll try and hide the things that tell me I'm wrong. And so whenever we read papers, we need to be aware of this risk. So what are the conflicts? Have we got all the data in? Has any data been hidden? But so during that time, we then went into the low fat. So the view was taken, you must eat a lot of low fat. But despite that, cardiovascular disease continued to rise. Diabetes took off in a big way. Nobody stood back and said, I wonder why this is.
Mm-hmm.
And only more recently, people have begun to realize that if you're eating fats that come direct from nature, so not interfered with by man and chemically changed, they do not cause harm. And particularly, as you said, the saturated fats. So this is where it sounds strange when we say it's okay to cook in butter. It's okay to use tallow and lard. In fact, it might be good for you to do that because you're going to feel full and actually eat less in the long term. So it really is turning everything on its head. And, if you'd said this to me 10 years ago, I'd have said, you're barking mad.
And me? Yep.
Yeah. But the key thing, I think, what we're doing, Andy, is so we're advising people to do this, and we're measuring what happens, and really yes. the outputs are absolutely staggering. So the whole of my career, it was told you cannot reverse type 2 diabetes. At a population level, we're doing it at above 50%. So 1 in 2 who are diabetic are ending up not being diabetic. 70% end up in a much better place.
Can we speak to that for a second, Donal? Because that's a really, really key point here. This is not theory-based stuff that we're saying, forget all those guidelines of the last 30 years. This is something we're measuring pre and post. So doing something that 10 to 12 years ago would have been thought of as lunacy, having patients eat unlimited amounts of saturated fat or meats or eggs. And I'm not saying it needs to be heavy in that, but not avoiding whole food sources of animal-based fats. What do we see in those patients? So we referred about we spoke about HDL and cholesterol, type 2 diabetes, blood pressure, fatty liver, weight around the midsection. Typically, what do we see in the studies we've done in these patients when they follow that higher fat, low carb, whole food diet?
Well, it all improves. The key thing that people will report is when I start eating this way, my hunger disappears. Because if your insulin drops, your satiety hormones improve. So we could spend another whole episode on Wegovy and GLP-1 injections. But this is a way of getting a natural Wegovy injection and killing your hunger. And then when you do that, and you get your body back into balance, technically what we call homeostasis, then diabetes, you're just creating health rather than treating symptoms of disease. And then diabetes disappears, blood pressure comes down, triglycerides often more than halve, HDL increases. The total cholesterol number may increase a little bit in some people, decrease in others. But as we said, it's if you decrease your insulin levels and your triglycerides, that's where you're getting your big bang for buck in improving my risk of getting heart disease. But of course, we don't measure it because there isn't a drug. and all systems are designed around the medical model. So we've created a different model that frankly has done way more than anything I have ever done in my career.
Yeah, and that's saying a lot. In terms of the practical takeaways, I suppose if you're listening to this for the first time and you're hearing, well, it doesn't appear to be saturated fat or cholesterol based on these guys' clinical experience and all of the other literature that's out there over the last while, what would you say, Donal, is the main driver of heart disease, and what changes can you make in your diet to mitigate those risks?
So it'll be multifactorial. So diet is a huge implication. Activity and exercise is another huge indication. But if you're staggeringly overweight and really unwell, it's really hard to do exercise. So our view would be fix the diet first, get you healthier. All right. So stop the sugar, stop processed foods, eat food as nature gave it to you. Don't snack, get wide gaps between your meals. And even if you can stretch them out further, that will have an amazing effect on your body. Then when you're feeling better and having a bit more energy, then plan on doing some exercise. What's the best exercise? The one that you enjoy. All right. Going for a walk. If you're into jogging, by all means, jog, get on your bike, join a football team, hurling team, handball, whatever. It doesn't matter. Anything that's going to get you a little bit active, a little bit out of breath. And all we need is what's called level 2 exercise. So you don't need to be like the rugby team were in France last week, where the prop, I think, lost 4 kilograms in 60 minutes, all down to sweat, right? We don't need to be doing things like that, but you just need to be doing enough that makes it hard to hold a conversation.
Yes.
So if you're going for a brisk walk and I can't finish my sentences if I'm speaking to you, Andy, that's the kind of exercise that's great. And just doing enough that, that you enjoy, because if you enjoy it, you'll keep doing it. You don't need a gym, but if you want to join a gym, by all means.
And to your point, you don't need to push yourself hard. It's not a more is better sort of thing. Actually, there's an interesting kind of a J-curve relationship between exercise and cardiovascular risk, in that if you do nothing, you're high risk. If you do a bit, 2 or 3 walks per week, risk goes down. If you're doing loads, like I have a brother who does Ironmans, he's doing 25 to 30 hours a week, your risk actually goes up. So statistically speaking, you wouldn't think it looking at him, he'd be higher risk of having a heart attack than me playing golf once or twice a week. So the point here, and it's an extreme analogy or thing to talk about, but you don't need to do loads. I mean, walking the dog a couple of times a week or just going for a brisk walk, like you say, being slightly out of breath, that will reduce your risk considerably.
Yeah. And the study for that was on bus drivers in London back in the 50s, where they compared the conductor and the driver.
Yeah.
So these were the old buses where the driver was in his own little unit. The conductor walked up and down the stairs. and they had the same sort of socioeconomic background, the same amount of smoking, same amount of drinking, but the bus drivers had twice the amount of heart attacks compared to the conductors.
Amazing. Yeah, speaks volumes actually. So in terms of the dietary approach, Donal, is it kind of fair to say that we're looking at insulin levels being far more predictive than, we'll say, total cholesterol and LDL in terms of determining risk of cardiovascular events? And that insulin is secreted predominantly when you're eating sugar and processed carbohydrates. So some of the main drivers to look at will be things like your frozen pizzas, granola bars, processed foods, even breads, cereals, and moving away from those to a kind of a more whole food diet that may include fruits, vegetables, ideally above ground, and even animal-based products. So meats, fruits, vegetables, berries, that sort of stuff.
Yeah, and I think the key, so we're talking to a lot of people who are at work. So, I think for work, you need to plan ahead a little bit. So one plan would be eat enough that you're full and you're not going to get hungry during the working day. So 3 or 4 egg omelette in the morning would be good. Or if you're going to have something like full fat yogurt and some berries, you may find you're a bit snackish during the day. And like I brought in some boiled eggs today. I'm going to crack them open and have them with salt and pepper at lunchtime, or even a tin of sardines. And then in the evening, green leafy veggies with whatever choice of protein you want. I enjoy salmon, beef, lamb. And then cook it in butter, lard, tallow, add cream to make a sauce. And suddenly the joy of food comes back.
Yeah, absolutely. There's two sides to it. Some of the stuff that's more addictive, the processed food, it can take a while to kind of wean off that. But certainly, I take like great pleasure in having a big steak with garlic butter and a couple of mushrooms and, veg and that sort of stuff. It's a different approach to foods for sure. But to my mind, it's much more enjoyable, especially when you balance off all the metabolic health benefits that come with it. I want to be really respectful in this question because I know that it's not a straightforward answer. But why do you think that most doctors will still, if a patient goes, refer to, you might want to reduce your eggs or your meats or saturated fat, despite the fact that the research has moved on so much? And again, I want to be respectful. I know doctors are very busy people dealing with hundreds of different things.
So the system that I worked in, I think I would describe it as a system of fear and guidelines. So if you step outside the guidelines, the risk of getting sued is high. So if I follow the mantra, nobody can give out or sue me, frankly. So, for many, many years, the view was taken, eggs must be bad because there's lots of cholesterol in them, so reduce them. Was the advice. And, the evidence now is it's the opposite, but it's like trying to turn the Titanic. It does take time. And if I've been saying something one way for 30 years, it's, I'm not going to change overnight. But I bet you in probably 5-6 years, there's going to be a significant change in advice that's going out there because as a nation, we cannot afford what's happening. The hospitals are already overflowing. If I'm ill, I could be sitting in casualty for 3 or 4 days. And as a whole nation, we need to improve our health so that if we do get ill, the system isn't overwhelmed with the vast amount of us having this diabetes epidemic that's going on.
Yeah, absolutely. And I think there's enough work going on there at the moment with the likes of, Virta Health, Dr. David Unwin, the work that we do in the NHS that is showing these whole food dietary protocols that include animal products and saturated fats, dramatically improving metabolic health across multiple parameters. It's very clear cardiovascular risk is going down after a 3 or 4 month intervention, doing the opposite of what most clinicians would have believed previous to the last couple of months.
Yeah, and one of the clinical directors who was in charge of a population of 50,000 in Waterlooville in the south of England, as he said to us, there is no drug that can do this. Yeah, and that was a really powerful statement. Yeah,
exactly. Donal, thank you so much for your time. I really appreciate it. I know you're busy, and I think the advice that we've given today, although it'll be news to a lot of people, will at least prick some people's interests and kind of maybe start looking up low carb healthy fat or low carb high fat as a way to reduce cardiovascular risk. I think it's been, even in just that 30-minute session, just really valuable gold information. So thanks again for your time, and thanks for everyone for watching, and we'll see you all soon. Thanks everyone. Bye-bye.
Bye.